Welcome to Health Styles, where we believe that everything you eat, drink, and think directly affects your health. I'm your host, Carole Dean. Did you know that we have information and education centers across the United States for alternative therapies for immune system disorders and cancer? Well, we do, and John Fink is our guest today, and he's done a lot of research in this area, and he's an author who will tell us how we can benefit from these centers, so please stay tuned. And our health tip section today is about misleading advertising. We'll tell you some of the name brands and what you should know to make the right choices. Dr. Murray Susser has his questioning medicine section today, and he'll tell us what's so important about our immune system and how to stay healthy. And Dr. Michael Clapper will answer the age-old question of where do vegetarians get their protein in his nutritional information section. That's our show. And now let's start with the health tip section. Now for misleading advertising, we'll start with Dunkin' Donuts because their latest advertising shows no cholesterol right on the front of the package. But the point is that many people think that also means no fat, and that's not true. Usually products will say no fat or low fat. So when you see no cholesterol, then turn your package over and look on the back and see how many fat grams it has, because more than likely it will have fat. And Dunkin' Donuts has 3 teaspoons of fat, so you really want to think twice if that's a product you want to eat. Now, Stouffer's has their lean cuisine, and in the front it says or in the back where it says 300 calories, and it makes you feel like it's really healthy. And again, Stouffer's puts on the front less than 1 gram of sodium. Well, you see, most of us are used to hearing about sodium in milligrams. So when you see less than 1 gram, you think, oh, that's really good. But it's not, because a gram is 1,000 milligrams. So I would hope that it's below 1,000 milligrams. So it means that it must be so high that they don't want you to know how high it is. So again, they're sort of misleading you. This information is all from the Center for Science and the Public Interest. They did extensive research, and we really trust them. So again, turn your package over, look on the back, and see how many sodium milligrams it has, because 1,200 is what most nutritionists tell you that you really want to eat in a full day. So that lean cuisine might be almost your daily allowance. The next on the hit parade is Alpha-Bits. Now, it says that it has no tropical oils, and it doesn't, and that's very important because, as you know, coconut oil is saturated fat and high in oils, and most people want to stay away from that. It says that it's whole wheat cereal, which it is. That's very good for you. But what Post discreetly omits is that it is 40% sugar. And if you eat the marshmallow Alpha-Bits, it's 50% sugar. So again, you may want to decide that that's something you definitely don't want to give your children. Now you know that hamburgers contribute more fat and saturated fat to the American diet than any other product. So when you see a burger like McDonald's that says 91 or 92% less fat, then you want to wonder, what does this mean? I'm trying to find out, where did that come from? We haven't been able to research that one yet. But the McLean burger, in fact, only has 10 fat grams. Now, that is a lot of fat grams, considering that they suggest women only have around 20 fat grams a day and men 30. So if you have a hamburger that's 10 fat grams, for a woman, that's half your daily allotment. But still, that is low, considering many others can be up to 30 or 40 fat grams. But what we want you to realize that when you see something that says 91% fat-free, then the question is, how many fat grams do they really have? Because if it was low in fat, they would probably say that. So question, again. And remember, Consumer Guide says that's the October issue, 68 nutritionists altogether said we should have no more than 3 ounces of red meat a week. Now that isn't a lot, so that's probably 1 hamburger a week. So you may keep that in mind. All right, it's time for us to break for Dr. Murray Susser, and please stay tuned. We'll be right back with John Fink, and we'll learn about the information centers across the United States.
System means freedom. The immune system is your body's complex machinery for fighting disease. immunity, as I said, means freedom. Originally in the Greek meaning, it was freedom from taxation. Now in the immune system, it means freedom from disease. The immune system fights invaders. It fights viruses, bacteria, other organisms which want to invade and eat us. It's a ghastly thought. But organisms that infect you are actually eating you. So if somebody says, what's eating you? That's how you could answer. I have the flu and the influenza virus is eating my body. Immunity means the immune system then consists of things we've all heard of. White cells, sometimes called white corpuscles, antibodies made from globulins, interleukins, complement, interferons, various things like that which work in a symphony to keep your body fighting diseases from degeneration, like cancer is considered a degenerative disease. There are cells in your immune system called natural killer cells, NK cells, which eat up cancer cells. So if you develop a cancer, your immune system has natural killer cells which will go out and eat that one cell. There are theories, for example, that we develop cancer 1,000,000 times a day, and the immune system defends against that. We are covered with organisms. We have 3 trillion organisms in our bowel. The immune system fights against those organisms and keeps them from invading us. Therefore, the immune system fights infection, fights diseases, and it consists of a whole array of agents and organisms, if you will, or of organic substances and biochemicals which protect us.
Thank you, Dr. Susser. And now I'd like to introduce our guest today, John Fink, who's the author of this book, Third Opinion. It is a directory of alternative therapy, information centers, and educational centers, and treatment centers across the United States. And thank you for coming, John.
Thank you for having me, Carol.
I'm very impressed with your book, and most importantly, I've wanted to get across the information for our viewers and start with the education and information centers and what do they do for people? How can we benefit?
Well, the education centers are there primarily for people who want to get oriented towards these things before the crisis hits. Although, you know, they're also useful for, as treatment centers are, you know, for people once the cancer or some other disease is set in. But they offer, and I'll give you some examples, the macrobiotic centers, the wheatgrass centers, and Wigmore-style centers, you're familiar with that, the raw foods, in other words. Those kinds of centers offer wonderful orientation programs towards proper eating and, or what they consider proper eating. And I think that it's a good place for a lot of people to start their education towards nutrition, to go and get absorbed in a program like this.
And they point out that nutrition really can prevent immune system disorders.
Oh yes, no question about that. I mean, and that's the ideal, of course, with all of this. In fact, my book it says it's not only for treatment, but it's also for prevention of cancer and other diseases. And that's the ideal, that people would get a hold of this information before the crisis hits and get onto a good program so that they can avoid any kind of mishap.
So if they go to an information or education center, they would talk about diet, and they'd teach them about macrobiotic diets and other things like that, is what you're saying.
Certainly the educational centers, you know, and a lot of those places listed under educational centers actually also operate, as I suggested earlier, as treatment centers, but they like not to be listed as treatment centers per se, just because that's not exclusively what they do, and they don't want that to be their focus. They aren't treating disease per se, they're treating the whole body. The information centers are slightly different in that the information centers just give information about all of these places, treatment centers, educational centers, support groups, and so on.
Because the Cushy Institute does say that you should eat more grains, and well, is there a general information about eating better, eating less meats and dairy? Did they come up with that information? Well,
I think, you know, it's a great question. I think that it's pretty uniform now, you know, among all of these centers, whatever their orientation, that you want to increase the fruits and vegetables and grains and whole grains, get the fiber up and get the fats down. And in fact, you know, what I wanted to say, because I knew I was coming on the show, I live in Santa Barbara, and we have a good New York Times-owned medium-sized paper in town. In 4 days, there were these articles that came out. The first one here was on the front page a couple of days ago about nutrition your mom was right. It says, because the ads and headlines, the dietary advice is simple and essentially the same as it's been since the mid-50s, so they say. You've heard it before, probably from your mom. Eat lots of fruits, vegetables, and grains. Cut down on the fatty foods. And
great. Well, that's what we're saying here too.
and then they say, with the American diet of burgers, fries, chips, and processed foods, we've gotten it completely backwards. Then I go to the next one, 2 days later, a totally different thing. You know, the American Heart Association, various diabetic groups, and cancer researchers are beginning to harmonize. The song they sing go as follows: avoid fat, avoid sugar, avoid sodium, and if you drink alcohol, do so in moderation. And or the do side of the melody of fruits, vegetables, and items high in fiber and grains, formerly known as roughage. And then they say down here, the biggest downfall are fast foods. Despite the fact kids are the ones who need to develop the tastes and habits compatible with healthy nutrition, I have yet to see a kid's meal that makes even remote nutritional sense. Then, I mean, I won't get into this whole thing. The next day, from the New York Times regional newspaper, an article in our very same paper about clinical ecology and the ways, if you have a problem with foods, and this is strictly alternative medicine, it's now being accepted as really a viable way of going. 800 clinical ecologists in the country, you know, of finding out what foods you may be sensitive to and have a problem with. And then I think it was today's paper, an article about the Moosewood cookbook lady. She wrote a book that was very famous about 15 years ago, and it was a vegetarian cookbook. And it says today a new one's come out and just abandons the recipes that were gooey with cheese, oils, eggs, milk, and replaces them with lean, trim versions with lots of garlic and ample seasoning. The point being that all of these things that used to be kind of alternative kind of information, you know, you had to dig down to get it. It's all there, you know.
It's coming out mainstream all the time.
It's coming out mainstream.
And when you're talking about allergies, there are 75% of the population, they say, approximately, that's allergic to dairy. So she was smart to redo her book and get rid of the dairy.
Right.
And besides, that puts on a lot of weight, and it's heavy fat grams. And I think that's the key these days. And if you stay on the low fat grams and the high fruits and fiber diet, you are going to be healthier. You can't not be.
Oh, yeah.
As long as you read the labels, which are really difficult sometimes to figure out. But now, tell us, you also run a support group center in Santa Barbara for people with cancer, right?
Yeah, it's Cancer Victors and Friends, and we're the oldest information organization in the cancer field. There are 15 chapters now internationally, and I've been president of the Santa Barbara chapter for the last 11 years.
Well, John, I was listening to some tapes that Nancy Appleton did, and on there it was talking about a group of, there were 80 women that had had mastectomies, and they were all of them were getting radiation, right? So they divided it in half, and one half just got the radiation, nothing more. The other half got radiation, and they belonged to a support group. And they learned hypnotherapy to deal with the pain. Now, the second half that went to the support group lived twice as long. And of course had more quality life than the other group. Yeah. So what have you seen along those lines with your support group? Well,
that particular study, let me tell you, was from a man named Spiegel at Stanford University a few years ago. And he set out to actually disprove this. I mean, not really, but he didn't believe in it. And he said, it's not going to happen, but I'll go ahead and set up the model and we'll go do this. So he was very surprised. He was a very mainstream kind of guy when he found out that the support group really meant that much to these people. And it really changed the mainstream's opinion of the psychological variables in treating cancer. It really has changed it enormously. And many new studies have come out. There's one out of UCLA just this year using not life longevity as an endpoint, but using as an endpoint, you know, one's well-being and sense of joy and lack of depression and all those kind of things, and found out significant differences with support groups. And even though our group is a support group of sorts, in that we are there for people with alternative therapies, we really function mostly as an information group. There are these support groups that function strictly as support groups, you know, in mainstream too. The I Can't Copes, the Make Today Count programs, all of these kinds of things.
And they're really beneficial. This is what people should know with immune system disorders and cancer, that you need to get in one of these groups. It will be very healing for you.
Exactly. Yeah,
Right.
I really think so.
And well, what's so interesting is that I noticed in some of the information center information that they were saying art and music was part of the therapy, and a stressless as much as possible stressless life. And there's an interesting article in the October issue of Technology Review, and it's talking about where East does not meet West, again saying, you know, about how they took one woman who had been, whose cancer went into remission because she was taking herbs and other animal products that they had given her. But they also put her on a situation where she had a stressless life, where she was out singing opera in the park. And the deal was that she's been, well, it was 8 years later and she is still cancer-free. But so there are alternative therapies being used in other places around the world that people could consider. I mean, our doctors have really not taken this yet, but it doesn't mean that it's not possible that other people can look at treatment centers for herbs, right?
Oh yeah, sure, absolutely. And I mean, the great encouraging thing for me in all of this is I've been at it for about 12 years, and it used to be either or. You did, you did mainstream medicine, or you went off with the quacks, and did alternative medicine. And I mean, that day is long behind us, fortunately, because
and they're working together now.
Absolutely, and you'll find a lot of mainstream people supporting fully, doing all kinds of aspects of alternative healing in conjunction with. Or if conventional therapy really doesn't offer anything, many of them are open-minded enough now to say, go on, try the alternative thing, and sometimes that works. That really does.
That's the key to bring them back to health. Well, all right, tell us about, well, I talked to Frank Wewell, president of the People Against Cancer Foundation, and because I wanted to find out some statistics, and what he had to say was, in general, he said, we are losing the war against cancer. He said that there's 62% more lung cancer and that it has overtaken breast cancer. Have you heard this?
Yeah, lung cancer's gone way up.
Why? What's happening?
Well, I think there are a bunch of factors. I mean, people say that smoking's on the decrease, but I go to certain places and I see people smoking rampantly. You sure never know it. I go over these high schools today and see these kids starting smoking, and I just can't believe with the information that's out there that they're doing it. That, and I think other environmental factors. And even though diet is very, very important, I have to say that you can be on the perfect diet and something may happen to you, and it may not be your fault, and it may be, the cause some kind of environmental influence out there.
You lived in L.A., right?
If you, well, yes.
That could be one thing.
Or many places, yeah.
All right, we're going to take a break now and go to Dr. Michael Clapper, and we'll be back with more information on cancer and alternative treatments. Now, if you eat vegetarian recipes, where will you get your protein?
Many people are concerned that the protein in plant-based foods is somehow inferior to animal protein, and this really is an unnecessary worry. It turns out that all the building blocks, all the amino acids that are in proteins that we need to build our skin, our fingernails, our hair, our bones, all of these are available in grains and cereals and breads, and even beans and fruits and vegetables have protein in them.
We don't know that from the education I got. I didn't know that.
Indeed, you wouldn't think so from looking at the posters hanging on the grammar school wall, but all plant foods have protein, and when you look around at countries that do not eat a meat-based diet, they certainly don't have protein deficiencies as long as they're eating enough food. So if you eat the breads and the cereals and the pastas and the potatoes and the beans, you're going to get all the protein you need. Protein deficiency really is not a problem in our country, even among vegetarians. It's protein excess is the problem.
So most people eat too much protein, right?
Indeed, we only need about 30 grams of protein a day. That's the weight of 10 pennies in your hand. That's all the protein we need. But most Americans eat 4 or 5 times that amount. We eat about 40 pennies worth of protein every day, and we eat over 100 grams. And for that reason, we are seeing diseases of protein excess. We see people with clogged up kidneys from all this extra protein, and thin bones that many doctors believe drains calcium from our bones due to the high protein loads. So for these reasons, less protein in the diet seems to be the healthier direction to move in.
So you don't have to worry if you're eating your pastas and beans and vegetables, you're getting all your protein.
You're going to get all the protein you need, and it's certainly high quality protein. It will meet all your protein needs.
Okay, good. And who's the author of this book, Third Opinion, and we are talking about cancer and immune system disorder treatment and education centers across the United States, and how good support groups really are. And the next thing is that Can participants, I mean, I understand that people who are working in support groups should be participants and not victims in their own healing, right?
Oh, yeah. I mean, originally our group was called Cancer Victims and Friends, if you can believe that. And that was incorporated back in 1962. But of course, then the whole notion came out in the 70s, late 70s. You don't want to be a victim, you want to be a victor. Fortunately, you know, there was a nice positive V word, so they could still leave it IACVF and just make victim victor. But there's no question about that. You know, the importance of one's participation in the process, the act of taking control of your life and getting involved in every aspect of the treatment and taking the lead and going out and searching for the information, I believe is part of the healing. And I think a lot of people feel the same way.
Because it would get you mentally tuned up. I think you would begin to believe that things are going to go your way. What about stress management? What types of stress management do they advocate in these centers?
Well, you know, there's a whole range of stress management that's available. I would say that for the cancer patient, of course, the most well-known kind of stress management is visualization, as developed by Carl Symington and Stephanie Symington. And that is visualizing, you know, going into kind of a meditative state and visualizing the cancer as being bad or whatever, you know, and something good coming along and getting rid of the cancer. And there are a whole lot of ways that people individualize that visualization. But I think that that's the most common. And of course, there are all kinds of meditations and so forth that people use.
Well, yoga, for example, I mean, they use that, Dean Ornish used that to help people reduce their heart disease.
Yeah, I'm very familiar with that study,
yes?
Dean's study, and I know Dean well, yes, he's done wonderful work.
So I would think that that would be very beneficial in immune system disorders and cancer too, right?
I think so. As an adjunct, I certainly think so.
So yoga, meditation, the things we used to laugh at now, they can be very beneficial.
Absolutely.
Right?
Can't hurt.
No, no, because it brings you back to center, and the thing is that your body is what's ill, and it really needs the rest to repair itself.
Right.
Right. All right, and so there are 15 treatment centers in Mexico, I noticed that. And let's talk about some of the different treatments. What about Gerson therapy? Are you familiar with that?
Oh, very familiar with Gerson. Gerson's where I started, you know, because I got into this, I was a professional actor, and I got into this through a child who had cancer. And then we went down to the Gerson therapy, and my wife said, let's do it as a family, because we can all benefit. It had its preventative aspects. We had some health problems, not related to cancer, but you know, so we did it for 1.5 years as a family. And I'd like to say it saved our little girl. It didn't. None of the other therapies did. I don't think anything would have. But we felt good about taking control of the situation. We felt good about the quality of life she had. But yeah, Gerson's amazing. I mean, I could go on for hours about Gerson.
Well, tell us, what do? How do they treat people?
They treat people with a lot of concentrated juices, about 13 juices a day, if you can believe that, made on a special juicer, made fresh, mostly carrot and apple, and some apple and green juices. And there used to be some liver juices, but they don't put that in there anymore. Now they take desiccated liver tablets. There's a detoxifying element, coffee enemas, in order to get all of the purged toxins out of the body once they're dumped from the fats in the body into the liver and gallbladder. Then you need a way of expelling them, and cancer patients have a load of them, as all people do on degenerative diseases. So that helps with that. Dr. Gerson was an amazing man, highly credentialed.
He cured Schweitzer, right?
Albert Schweitzer and Albert Schweitzer's wife called him the eminent medical genius of all time. And of course, he ran into, as a lot of these guys do, a lot of troubles once he came over to the United States and became more high profile. And the medical establishment realized what direction he was going, and he did not have their blessings, even though they'd hailed him when he came to this country.
Because he was going with natural diet to begin with, right? Exactly.
I mean, yeah, there was nothing patentable. There were no drugs. There were just natural therapies. And he was a great pioneer in all of this. And a lot of the notions he had and that he wrote about years ago, 30, 40 years ago, have come true. I mean, they're all things that are now being scientifically proven, so it's kind of amazing.
Well, I've talked to Marilyn, who had melanoma, went to the Gerson Institute, and she is a very attractive and youthful-looking lady today.
Yeah.
Because of that treatment, and she's very healthy. That's good to know. But the point is that a good diet can prevent cancer, and that's what, I don't know that it can, but it can at least get your immune system healthy enough so that if you do get cancer, you've got a better shot at healthy or living through it than you would if you didn't have a good immune system.
Exactly, and I do think that there is a definite preventative aspect, because once the immune system is functioning properly, a lot of people feel that, you know, cancer may happen to us all the time, but our white blood cells, if our immune system's intact, fight that off and it goes away. You know, the cancer cell doesn't develop. So that's the importance of having the immune system functioning.
Because a healthy immune system will eat up cancerous items,
Sure.
and nowadays you never know what's going on with your food. You've got to be very careful.
You do?
Thank you so much. We really appreciate the information you've given us, and thank you for the book that you've written, because it's beneficial to all of us.
Well, thank you.
And I've got some consumer tips in closing, and one of them is just what we were talking about. It has to do with toxins. Some wonderful lady caught Safeway spraying their produce at night. Every night they've sprayed their produce with pesticides. And they'd done this for 8 years. And so somebody came along and said, oh, this is wrong. So they fined them $100. Well, she was irate, and she joined with another man, and they did a class action suit against them, which is wonderful, because it's important for you to know this for 2 reasons. First, you might want to ask your local grocery store, do you spray my vegetables at night with pesticides? Because if so, I don't want you doing that. And also that your doctors will tell you that the flu symptoms are the same as food poisoning. So many times when you think that you've just got the flu, you really could have had food poisoning from an overdose of pesticides in your fresh fruits. So be very careful about that. And CPSI says that there are some trials going on right now to see if beta-carotene will help keep your immune system better, and if you really need to take supplements. And these trials are being taken by healthy doctors at all the cancer centers. I think that sounds really good. And also smokers are taking beta-carotene. I think it's 25. The doctors are taking 42 international units of beta-carotene, and the smokers are taking 50 and 25,000 international units of vitamin A. So the information is out there that supplements are important for your immune system, and of course our Dr. Susser is always saying that. So you might consider, how much beta-carotene do you get a day, and do you need more? So remember, orange things like sweet potatoes, yams, tangerines, cantaloupes, etc., all have your beta-carotene, and be sure and eat your 6 to 8 servings of your fruits and vegetables a day, because we really feel what you put in your shopping cart directly affects your health. And that's it. That's our show today. Thanks to all the crew at CVI for making the show possible, to our producer and her associate.